Did you know that statins drugs can more than double your risk of developing dementia? If you're on statin drugs and notice that your brain is in a fog, or you're just feeling physically weak, watch this video. Today we'll discuss the debilitating adverse effects of statins they don't want you to know, and the many major functions of cholesterol in our body. In 2012, the FDA mandated black box warning for all statin medications, indicating the potential adverse effects on cognitive performance, including amnesia, memory loss and confusion. Additionally, a 2015 meta-analysis showed that statin drugs, taken at high doses, were linked to an increased risk of type 2 diabetes. Let's discuss lipophilic statins. According to a recent study published in the Journal of Nuclear Medicine, people taking lipophilic statins have more than double the risk of developing dementia compared to no statin use. The lipophilic statins to avoid include atorvastatin, Lipitor, simvastatin, Zocor, lovastatin, Mevacor, fluvastatin, Lescal, and pitavastatin, Livalo. They have been shown to cause major health issues such as liver damage, erectile dysfunction, type 2 diabetes, dementia, and much more. For some odd reason, however, statins are considered to be the first line of drugs prescribed for high cholesterol, with Crestor and Lipitor being by far the most common. Moreover, a sharp increase in statin use has been reported among people 40 years or older. According to a series of case studies, many new statin users, regardless of age, have experienced immediate signs of brain fog, leg cramps and increased hostility during the first few days. By the way, based on the Blue Cross Blue Shield Health Index, early onset of dementia or Alzheimer's is on the rise among Americans between the ages of 30 to 64. For example, about 131,000 people in that age bracket were diagnosed with either Alzheimer's or dementia in 2017. For people with mild cognitive decline, statin use is not recommended as it can accelerate the development of dementia. According to the CDC, almost 50% of Americans 75 and older are placed on statin drugs. The million-dollar question is why, especially when their risk of having dementia is higher. It's very seldom that your doctor would educate you on how statin works before prescribing it to you. Most people are not aware of the dark side of statin drugs. These statin medications work quickly by blocking the enzyme that helps the liver make cholesterol. Now, to fully understand how these drugs impact your health in a negative way, you need to know the functions of cholesterol in your body. Cholesterol has a significant purpose in human life, as it is found in all the cells in the body. It builds the structure of every cell membrane. It supports the production of hormones such as estrogen, progesterone, testosterone, and vitamin D. It helps build and repair tissues, thus keeps our skin healthy. It fuels our brain and nervous system. It helps the liver make bile salts for proper digestion. The brain is very rich in cholesterol, and it contains the highest level. Unfortunately, statins are able to cross the blood-brain barrier, lowering the amount of cholesterol in the organ. This impairs brain function, resulting in cognition decline such as slow learning, memory loss, and mood disturbances. Since cholesterol is present in every cell, insufficient level causes a multitude of adverse effects throughout the entire body, especially the brain. This explains why many statin users experience adverse effects throughout the body, from brain fog to liver damage. Later in the video, we'll list some surprising adverse effects of statins, which are warning signs that your body is in dire need of more cholesterol. And the longer you remain on statin, the more debilitating the adverse effects will be. Furthermore, many people are not aware that statins also deplete coenzyme Q10 in the body, causing muscle weakness, extreme fatigue, low back pain, myopathy, and even heart failure. Taking this supplement when you're on statins can lessen the symptoms of myopathy and help you feel more energetic. A blind study involving 34 patients measured their coenzyme Q10 blood levels before and after taking 80 milligrams of Lipitor for 14 days. The results showed a significant decrease in their coenzyme Q10 blood concentration. For statin users who choose to remain on the drug, remember to always take this supplement in the form of ubiquinol, while closely monitoring for signs of the following adverse reactions. 1. Brain fog, memory loss, disorientation. 2. Increased risk of type 2 diabetes by 71% in women and 45% in men. 3. Peripheral neuropathy, numbness, tingling in hands and feet. 4. Increased risk of shingles. 5. Increased risk of osteoporosis. 6. Joint pain. 7. Depletion of coenzyme Q10 shown as muscle pain, muscle weakness. 8. Increased liver enzymes and eventually liver damage. 9. Low testosterone, loss of libido. 10. Erectile dysfunction, shrunken testicles. 11. Unexplained irritability, insomnia, depression. 12. Increased risk of pancreatitis by 33%. 13. Dementia. In conclusion, statins are not safe. They can destroy your brain and lower your quality of life with horrible adverse effects. On the contrary, cholesterol is essential for good health. It's used by the body to create cells, hormones, bile salts and other substances. There's an interesting book on cholesterol, The Great Cholesterol Myth. It's quite educational. Thanks for watching.